Good morning. If I encountered a situation during ward rounds, my immediate priority would be patient safety. A doctor who appears impaired by alcohol might not be able to make safe clinical decisions, and continuing patient care in that condition could place patients at a significant risk of harm. At the same time, I would recognize that this is a sensitive and distressing situation involving a colleague, so I will aim to manage it professionally, respectfully, and without humiliating them publicly. My first step would be to discreetly remove the colleague from direct patient care as soon as possible. I would approach them privately, away from patients and staff, and calmly express my concerns. For example, I might say, "I'm concerned because you seem unwell and I notice the smell of alcohol. I don't think it is safe for you to continue reviewing patients right now." I would avoid being confrontational or accusatory. However, I would remain firm that the patient's safety must come first. After that, I'll immediately escalate the matter to the appropriate senior person, such as the registrar, consultant, or medical officer in charge according to the hospital policy. It would be inappropriate to ignore the issue or attempt to manage it entirely on my own. Documentation and institutional support are important in situations involving possible impairment, so definitely I will check what was documented to make sure there is no any discrepancy in reviewing patients. I'll also ensure that any patients that has already been reviewed by the colleague are reassessed if necessary, especially if medications or clinical decisions were made while the colleague may have been impaired. Balancing patient safety with support for my colleague is important. Although doctors have a duty to protect patients, we also have a professional responsibility to support colleagues who may be experiencing stress, burnout, substance misuse, or personal difficulties. Therefore, after immediate safety concerns are addressed, I would encourage the colleague to seek appropriate help through occupational health services, employee assistance programs, counseling, or professional support systems. In the longer term, the issue should be managed through proper institutional processes, including assessment of fitness to practice, monitoring, and rehabilitation if needed. The goal should not only be disciplinary action, but also recovery and prevention of future harm. Several ethical principles guide my actions in this scenario. The principle of non-maleficence or do no harm require me to protect patients from unsafe care. Beneficence means acting in the best interest of both patients and my colleagues. Professional integrity and accountability requires doctors to act when they witness unsafe practice. There's also respect for confidentiality and dignity, meaning the matter should be handled discreetly and professionally. One major challenge is the fear of damaging professional relationships or causing embarrassment to a colleague. There may also be uncertainty about whether the colleague is truly impaired. However, failing to act could place patients at risk and would itself be unethical. In conclusion, I'll handle this situation by prioritizing patient safety, addressing the issue promptly and respectfully, escalating concerns appropriately, and ensuring the colleague receive professional support. Upholding professionalism sometimes means having difficult conversation, but these actions are necessary to maintain trust in the medical profession and ensure safe patient care. Thank you.